Good day, everyone. Now we are going to dig deeper about the process and most hazards to prenatal development. Okay, so these are the objectives. First, trace the course of prenatal development and explain the most common hazards to prenatal development, appreciative of the gift of life as manifested in anti-abortion stand. Okay, so what is prenatal development? Prenatal development is defined as the process of growth and development within the womb from fertilization until birth. During this process, the zygote grows into embryo and then turns into fetus. Then, there are three main periods of prenatal development. First is the germinal period, embryonic period, and the fetal period. So the first process of prenatal development is germinal period. Germinal period is about 14 days in length and would last from conception to implantation of the zygote or fertilized egg. Fertilization occurs resulting in the formation of a zygote. The zygote undergoes rapid cell division and travels to the uterus. Implantation takes place as the zygote attaches to the uterine wall. So the second process of the prenatal development is the embryonic period. Once the zygote is implanted in the uterine wall, the embryonic period begins, and the major organ systems begin to form. The embryo develops as a neural tube, which will later become the brain and the spinal cord. Basic facial features, limbs, and internal organs start to develop also. The heartbeat can be detected, and the embryo is susceptible to external influences. And the last process of prenatal development is the fetal period. The embryo is called a fetus when the organism is about 9 weeks old. It is about the size of a kidney bean. As the tail begins to disappear, it takes on the recognizable form of a human being. And the fetus continues to grow and mature. Also, organs and body systems become more complex and functional. Brain development occurs and the fetus becomes capable of movement. Lastly, the fetus gains weight and prepares for birth.
Developing children are particularly vulnerable during the first 3 months of pregnancy, which is known as the first trimester. Several factors can contribute to potential risk during this critical period. Teratogens, which are substances that can cause birth defects, can have a profound impact during the early stages of development. Some women may not be aware of their pregnancy during the initial weeks or months. Unintentionally exposure to harmful substances like teratogens during this time can occur when the mother is not yet taking precautions to safeguard the developing fetus. This lack of awareness may lead to inadvertent exposure to environmental hazards, medications, or substances that pose risk to prenatal development. Teratogens are known to cause approximately 10% of all birth defects. This can include structural abnormalities, developmental delays, and functional impairments. Prenatal exposures to teratogens, such as certain medications, infections, or environmental toxins, can interfere with normal fetal development, resulting in a range of congenital issues. It's crucial expectant mothers to receive early and regular prenatal care to monitor the health of both mother and the developing fetus.
Next, we have alcohol, and this is one of the most commonly used teratogens. Now, we have here the possible effects to the babies. The first one, we have fetal alcohol spectrum disorders, or what we call FASD. This is not a single disorder, but it includes various conditions, and its effects can vary wildly from person to person. The most severe well-known condition within FASD is fetal alcohol syndrome, or what we call FAS. This is characterized by specific facial abnormalities, growth, deficiencies, and central nervous system. However, not all individuals with FASD exhibit these facial features. It is important to note that FASD is a preventable condition and the effects are permanent. Now we have here the possible birth defects of a fetal alcohol syndrome. We have here low nasal bridge, minor ear abnormalities, epicanthal folds, short palpebral fissures, and distinct philtrum, micronesia, flat mid-face, and short nose, and lastly we have the thin upper lip. Next we have the alcohol-related birth defects, or what we call ARBD. This refers to the physical abnormalities and defects that can occur in a baby within a pregnant woman consumes alcohol. Unlike FASD, which has a specific set of facial features, ARBD primarily focuses on physical defects that affect various organs and systems in the body. The specific birth defects associated with ARBD can vary and may include abnormalities in the structure and functions of the heart, kidneys, bones, or other organs. These defects can lead to a range of health issues and challenges for the affected individual throughout their life. Next one, or the number 3, we have alcohol-related neurological disorder, or what we call ARND. Unlike FASD, where there are distinct facial abnormalities and growth deficiencies, ARND primarily involves central nervous system problems and developmental issues. The effects of ARND can manifest in various ways, impacting cognitive function, behavioral learning, and social skills. Individuals with ARND may experience difficulties with attention, memory, impulse control, and adaptive functioning. The kidney, bone, and heart problems has less extreme symptoms. These are the possible defects of fetal alcohol syndrome. We have low nasal bridge, minor ear abnormalities, epicanthal folds, short palpebral fissures.
When a mother smokes during pregnancy, it can have several negative effects on the developing baby. Some of the features or consequences of maternal smoking during pregnancy include: first, we have low birth weight. Babies born to mothers who smoke are more likely to have a lower birth weight compared to babies of non-smoking mothers. This is because smoking restricts blood vessels, reducing the amount of oxygen and nutrients that reach the fetus, or increased risk of sudden infant death syndromes, or SIDS. SIDS is the sudden and unexplained death of an otherwise healthy baby. Babies born to mothers who smoke have a higher risk of SIDS compared to babies of non-smoking mothers. The last one is we have increased risk of birth defects. Smoking during pregnancy increases the risk of certain birth defects such as cleft lip and palate, heart defects, and limb abnormalities. It is important for expectant mothers to avoid smoking and exposure to secondhand smoke to protect the health and development of their unborn baby. Quitting smoking or seeking help to quit is highly recommended for the well-being of both the mother and the baby. Balik conclusion. It is important for expectant mothers to avoid smoking and exposure to secondhand smoke to protect the health and development of their unborn baby. Quitting smoking or seeking help to quit is highly recommended for the well-being of both the mother and the baby.
Okay, let's move on to hazardous drugs. Hazardous substances such as drugs can have detrimental effects on prenatal development. When pregnant women use illicit drugs such as marijuana, cocaine,
ecstasy, amphetamines, or heroin, it can lead to various negative outcomes for the child. Some of the effects of drug use during pregnancy include: first, low birth weight. Drug use during pregnancy can contribute to low birth weight in infants. Low birth weight is associated with an increased risk of health problems and developmental delays. The second one is withdrawal. If a pregnant woman is dependent on drugs, the baby may experience withdrawal symptoms after birth. This condition is known as neonatal abstinence syndrome and can cause irritability. The second one is we have withdrawal. If a pregnant woman is dependent on drugs, the baby may experience withdrawal symptoms after birth. This condition is known as neonatal abstinence syndrome and can cause irritability, tremors, feeding difficulties, and other complications. The third one is we have birth defects. Certain drugs, especially when used during critical periods of fetal development, can increase the risk of birth defects. These defects can affect various organs and systems, leading to long-term health issues for the child. Lastly, we have the learning and behavioral problems. Prenatal drug exposure has been linked to learning disability. Lastly, we have learning and behavioral problems. Prenatal drug exposure has been linked to learning disabilities, attention deficit hyperactivity disorder or the ADHD, and other behavioral problems in children. These issues can impact the child's academic performance and overall well-being. It is important for pregnant women to avoid using illicit drugs and seek appropriate medical care to ensure the health and well-being of both themselves and their unborn child. Okay, let's proceed to hazards to prenatal development. During prenatal development, there are several hazards that can potentially affect the health and development of the fetus. Two common hazards are exposure to environmental chemicals and radiation. First, we have exposure to environmental chemicals. Okay, pregnant women should be cautious about exposure to pollutants, organic mercury compounds, industrial solvents, and herbicides. These substances can cross the placenta and potentially harm the developing fetus. They have been associated with various adverse effects, including congenital deformities, developmental delays, cognitive impairments, and organ damage. The last one is we have radiation. Another hazard to prenatal development is radiation exposure. High levels of radiation, such as from X-rays of certain medical procedures, can increase the risk of miscarriage. Additionally, radiation exposure during specific stages of pregnancy can lead to birth defects, growth problems, intellectual disabilities, and an increased risk of cancer later in life. So it's very important for pregnant women to take precautions to minimize exposure to these hazards. This includes avoiding or minimizing contact with environmental chemicals, following safety guidelines in workplaces that involve hazardous substances, and discussing the potential risk of radiation-based medical procedures with healthcare professionals. Regular prenatal checkups and consultations with healthcare providers can help ensure a healthy pregnancy and minimize potential risk to developing fetus.
Sexually transmitted infections (STI) can pose hazard to prenatal development. Premature labor (STI) such as syphilis and herpes can increase the risk of premature labor. These infections can cause inflammation and infection in the reproductive organs, leading to contractions and dilations of the cervix before the 37th week of pregnancy. Premature labor can result in the birth of a premature baby who may face various health complications due to their underdeveloped organs and systems. Premature rupture of membranes. STIs, particularly chlamydia and gonorrhea, can increase the risk of premature rupture of membranes, or PROM. PROM refers to the breaking of the amniotic sac before the onset of labor. This infection can weaken the membranes surrounding the baby, causing them to rupture prematurely. PROM can lead to complications such as infections. Premature rupture of membranes, STIs, particularly chlamydia and gonorrhea, can increase the risk of premature rupture of membranes. PROM refers to the breaking of amniotic sac before the onset of labor. Low birth weight infant. STIs such as HIV, herpes, and syphilis can contribute to the birth of a low birth weight infant. These infections can interfere with the transfer of nutrients and oxygen from the mother to the baby, resulting in an inadequate fetal growth and lower birth weight. Low birth weight infants may face challenges such as respiratory difficulties, feeding problems, and an increased risk of infection. It is important for pregnant individuals to receive regular prenatal care, including STI testing and treatment if necessary. Early detection and appropriate management of STIs can help reduce the risk of these complications and ensure the health and the well-being of both the mother and the baby. Practicing safe sex and using barrier methods of contraceptions such as condoms can help prevent the transmission of STIs and protect against these hazards during pregnancy.
Maternal diseases such as diabetes, cytomegalovirus, strep B, and rubella can have significant adverse effects on the developing fetus. For instance, if the mother contracts rubella during the first 3 months of pregnancy, it can lead to damage to the eyes, ears, heart, or brain of the unborn child.
Adverse effects on the fetus, leading to various complications. Two significant adverse effects of maternal stress on the fetus are preterm birth. Maternal stress has been linked to an increased risk of preterm birth refers to the delivery of a baby before completing 37 weeks of gestation. So number 2 is low birth weight. Maternal stress can also contribute to low birth weight in infants. Low birth weight is defined as a birth weight of less than 2,500 grams or 5.5 pounds. Babies born with low birth weight are at a higher risk of health complications, including respiratory problems, feeding difficulties, and developmental delays. So, it is important to note that maternal stress is a complex issue influenced by various factors including socioeconomic status, social support, and individual coping mechanisms. Managing maternal stress during pregnancy is crucial to promote the well-being of both the mother and the developing fetus. Healthcare providers often recommend stress reduction techniques such as relaxation exercises, counseling, and support groups to help pregnant women cope with stress and minimize its potential adverse effects on the fetus.
Conclusion, a healthy prenatal environment is crucial for proper fetal development. Avoiding known hazards and maintaining good maternal health are key factors in ensuring a positive outcome for both the mother and the developing baby. Regular prenatal care and a healthy lifestyle contribute significantly to a successful pregnancy.